Good afternoon. This is Jessica Barnes, and I'm going to be doing my IV administration video. Okay, first I'm going to verify my doctor's orders, and I'm going to assess any contraindications or any problems that the patient might have to a venipuncture on either side. I'm going to review my MAR again for correct patient, med, dose, route, and time. Again, we always perform our three medication label comparisons. And then you always do your 9 rights, right patient, right med, right dose, route, documentation, time, right to refuse, response, and the right reason. Yep. Med, dose, route, time, documentation, reason, response, and right to refuse. Okay, and then I'm going to gather all my supplies, which I have here. Check the expiration dates on any of my fluids or my antibiotic. Always checking for allergies. And we can go ahead and perform any drug calculations that we might need. And I do have an order here. This is my MAR. I have an order here for Kefzol. 475 milligrams IVQ 6 hours. I did do my drug calculations, and I'm going to run this at 60 mLs an hour. Again, I can go ahead and compare John Smith, correct date of birth, Kefzol 475 milligrams, Kefzol 475 milligrams, not expired, so we're good to go. Always wash our hands and introduce myself. Hi, my name is Jessica. I'm going to be your nurse today, and I'm going to be doing a venipuncture, giving you antibiotics, giving you a medication, and later on you have to go to x-ray, so I'm going to convert to an INT. It ultimately, at some point, we can discharge you home, and I will discontinue the IV. Okay, so I'm going to perform my venipuncture. Again, my hands are washed. Put on my goggles and my gloves. Okay, can you see? I'm going to open my IV start kit. Being very careful, you don't want to cross your sterile field. And again, my table is cleaned, and I have a clean surface down. Again, you don't want to work over your sterile field. And I just want to kind of separate them, just like I saw Ms. Murphy do. Kind of separate so it'll be easier for me to get to. Okay, so I'm going to apply my tourniquet. Once we apply the tourniquet, we always check for a pulse. Okay, so I have my pulse. I'll choose the vein. I'm going to use this one. So once I found my vein, I can go ahead and pop my tourniquet. Now I can go ahead and set up my extension. Always maintain the sterility. Alright, and I have my saline flush. Put that in my trash. I don't want anything on my clean surface. Always go ahead and remove the air that's in the syringe by pushing up on the plunger, removing any air. Okay, and then now I'm going to attach my syringe to my extension port. I don't have to clean this off because it's considered sterile in this package. So I go ahead and attach my syringe so that it's ready to go. Now at this time, I'm going to go ahead and prime the extension. Okay, and I have water saline at the end of the cap. And we can go ahead, I'm gonna place it back down here, and we can go ahead and loosen up our top. Again, leaving the top on because we want it to remain sterile. Again, never crossing over our sterile field, always maintaining sterility. Okay, so loosen up my clamp. So now I can go ahead and, yep, I'm ready, about ready. So I can go ahead and put my tourniquet back on. Again, checking for that pulse. And we can go ahead and ChloraPrep the site. It's a 30-second scrub. Trash that. You listen for the click. The fluid builds up at the bottom. I dab a little bit, and then I'm going to scrub for 30 seconds. Like Ms. Murphy said, we're going to scrub really big, and then on the last couple of seconds, we want to really get to where we doing our venipuncture at. Can y'all see? Okay. All right. So now at this time, I can go ahead and open my Gelco. And again, all of my products that I have here, I already checked it for expiration dates and the integrity of the package. Same here, I have my Gelco here, 22 gauge times 1 inch. This is not expired and is ready to go. And again, we can go ahead and open this while we're waiting for the ChloraPrep to dry. And we're going to make sure, test it, and my needle is ready to go. Okay, so it's dried, and I can go ahead and insert with the bevel up at a 10 to 15 degree angle. Okay, so now I'm going in, bevel up. I have my flash, so now I'm going to drop down at the angle and advance my catheter, and I'm going to pull back on the stylus till I hear the click. Once I hear the click, then I stabilize my catheter, and I can go ahead and pop the tourniquet. Alright, so now I'm going to stabilize it again, and now I can go ahead and attach my extension. Again, very serious whenever you're ready to attach the syringe, the extension port, you have to do it quickly. Alright, so quickly, and it's attached. And I'm going to pull back to make sure I'm getting blood return, which I am, and I'm going to inject my saline. And while I'm injecting my saline, I'm checking to make sure, I'm checking for signs of any infiltration. Okay. Alright, so once I have that in, I can go ahead and get my Tegaderm so I can secure it. Never letting go of my catheter. Never crossing over my sterile field. And I'm going to secure my Tegaderm there. Peeling, just walking the tape off. Here's my label. Taking my tape, securing it with my tape. Gloves won't do it right. And then I'm going to tear it in half, and we're going to chevron it. So I'm going to go up under and kind of crisscross it, so to speak. Okay, again, then the second piece kind of just comes down like so. Okay. Again, my this goes in my sharps. It's secured with my Tegaderm. I secured it with tape. Oh, and I can kind of just take this and I'm gonna undo my syringe, and I can just put it there. And I will secure the rest of my extension with tape. Okay, so that's it. It's supposed to have been sharps. My patient is good to go. I remove my gloves, my goggles, and I wash my hands. And that was my venipuncture. So I think on my venipuncture, I'm just going to move this out the way so I can do my next step. Oops. Well, I definitely want to slam that on my patient. And just cleaning up my mess because I'm done with that for now. And again, I would date, time, and initial my IV. Daytime initial my IV. Okay. So, okay, so after my venipuncture, I can go ahead and hang my my primary bag of fluids. My IV pole is there. And again, I'm checking the integrity. Check the expiration date. Check the order that this is the right fluid that the doctor ordered. Is appropriate. Give it a little squeeze to make sure it doesn't have any holes in the bag. So I'm going to go ahead and hang my fluid there. Now I can get my primary tubing. Open it and again checking for any expiration dates, cuts, holes, tears, or wetness. And the first thing I'm going to do as soon as I open up my package is we're going to go ahead and put that roller clamp, close that roller clamp. Alright, so my roller clamp is closed. First thing you want to do is close your roller clamp. Okay, and now this is the part where you have to really maintain your sterility. Trying to hold it right so that I'm never breaking sterility. I can okay, so I'm going to take this off again, maintaining sterility, and for home purposes I'm going to have to hold this because I don't want my hanger to break. But again, I know to be sterile with this and spiking it. And then I'm going to spike it, twist, push, twist, push, twist, push, twist, push. Yep, twist, push. Then you want to get some fluid in this chamber. About half full. Okay. Then we want to run our line. Run our line. Okay. And then now we're going to open our clamp. Checking for air bubbles. And again, always invert. Invert. Oh, keep my roller clamp close. I always want to keep control of mine. Run it. Run it. And here it goes. And again, we're checking for air bubbles. If we have any air bubbles, we can give it a thump, thump, thump. Or use your pen and thump it as so. Okay. And again, you know it's going when in the drip chamber you can see drops. Okay, so now I'm at the end, and we're kind of good to go. We don't have any air bubbles. Okay. All right, and I'm going to sit this here. It would have been lying on my patient. And again, we're going to label this tubing with the date and the time. Okay, and again, always wash your hands, removing gloves, wash your hands, those post-procedural things. Okay, the next step I can do is I'm gonna just go ahead and hang my secondary bag. I would actually have to turn the pump on. So let me start there. So after I have my primary IV fluids going, I labeled it, no air bubbles, we're good to go. First things first, we have to turn on our pump. You have to connect it first to the outlet, connect it to the outlet, and then turn it on. You always have to have it on. I wish I had a pump in front of me, but you have to thread it through. Once you thread it through, then you could turn the roller clamp all the way up. Well, open the roller clamp all the way up. When it pops up, you want to just make sure it's the right patient, the right rate, primary fluids, because that's what I'm hanging. Make sure it's primary fluids. Just make sure your pump is set right, and think right channel. So then you program the pump with the correct settings, which my Mars says 500 cc, the normal saline going at 75 an hour. So that's what I'll set my pump on per doctor's order. We can't change it. That's what the doctor ordered. Just program the pump. Make sure you have the right volume. And then when you're ready to hook it up to the patient, you want to definitely alcohol the end of the extension port and connect them like that. So clean. You're definitely going to clean the extension port here, and you're going to connect it here. Again, I would have on gloves. I'm just talking through this part. And take off the end, and that's sterile. So you won't have to clean this part, but you just hook it up, and you kind of want to watch it while it's going to the patient. Then press start. Press start. Okay, so that's programming the pump, and then I can go ahead and do my secondary bag, which is my antibiotic, my Kefsol 75 milligrams. It's a 50 milliliter bag. And I'm sorry, this was a 500 bag. Okay, again, make sure we do our, we review our MAR, make sure we have the right patient, med, dose, make sure it's the right time, make sure it's the right route, which is going to be IV. Our 3 medication, label comparison, John Smith, date of birth, Kefsol 75 milligrams, Kefsol 75 milligram. And again, I did my drug dosage calculation, and I'm going to set it at 60 mLs an hour. Okay, and I believe I'm ready to open it up. I'll get my trash out the way. Trash can. Again, we're gonna look at it, make sure it's not expired. give it a little squeeze to make sure it doesn't have a hole in it. Right, and that's it. And then I have my secondary set here. Okay, so I'm gonna go ahead and put on my gloves. I'm gonna just put my goggles on as well, and then I'm gonna do my gloves. Again, I'm still in the room, but my hands are clean. Alright, so I'm going to hang my bag, and my secondary bag is always higher than the primary bag. Okay. Secondary set, again, I check my expiration date. It's not expired, there's no cuts, holes, tears, or wetness or damage done to the package. Trash. Okay, again, with these spikes, we always want to maintain sterility, and also we want to make sure the roller clamp is clamped off. We don't want to waste a bunch of antibiotic and then have to call the pharmacy and tell them that we wasted it. So my clamp is off. And again, it's a short tube, and so after I spiked it and once I am ready to prime it, I always keep my hand on the roller clamp and never let it go. Again, I kind of have to hold it here because I don't want to pull my hangers down. Well, I'm going to take this off, but again, I'm going to take this off, but I know that I can't contaminate this because this is considered sterile. Pop that. Twist, turn, twist, push, and again put some of our fluid in the drip chamber. Alright, and then we're ready to crank it up. Again, it's short, and again we're holding it up, watching very, very carefully. You don't want to lose control of this. Okay, and then I have it at the top. Alright, and you always want a little bit of, you want to see it in the cap so we know we don't have air bubble up there. Okay, so I clamped it. Again, never lost control. Maintaining sterility. And we can attach our end cap. But we would cleanse the Y port of my primary, attach this to there after we take that off, and I'm just going to put it here for time's sake. Again, my bag is lower than my primary is lower than my secondary, so once I have my secondary hooked up to the Y port to the primary after I cleaned it, of course, I press secondary on my pump, and again program it with the right rate per hour, which is 60 milliliters an hour. Make sure that we enter everything that we needed to enter, program our pump, make sure it's the correct rate and the value, which is a 50 milliliter bag. Right, and then when we open the roller clamp and press start, and it should infuse into the patient. And again, we always want to observe for any adverse reactions. And again, before we do anything with the antibiotic, we always ask the patient if they have any allergies. Any allergies to, and I should have did it at the beginning, but any allergies to latex, chloroprep, iodine, betadine, and shellfish. And my patient only has allergies to aspirin and penicillin. So again, that's what we would ask in the beginning. And again, when we're hanging an antibiotic. And that's it for that. Take my gloves off, remove my goggles, wash my hands, and I'm going to document. Okay, so now my patient needs to go to X-ray, so we have to convert to an INT. So again, you gather your supplies. You'll have your gloves and your goggles on. I would put my pump on hold. I'll put my pump on hold and disconnect my IV tubing and always apply a dead end cap. You're going to clean off my extension ports with alcohol for 60 seconds. Allow it to dry. Then we have to flush it. But before we flush, we always push up so we can take the air out of the syringe. Once we remove the air of the flush, then I can again clean off my extension port, flush him, and secure the the extension port. So now he's off to X-ray. Again, you always wash your hands and remove your gloves and wash your hands. Okay, so now he's back. The doctor ordered furosemide 40 milligrams IV push, Q6 hours. Again, you always verify the doctor's order, review the MAR, make sure you have the right patient, med, dose, route, and time. You do your 3 medication label comparisons to the MAR to make sure that this is the right order. And again, we do have furosemide 40, John Smith, date of birth. Okay, so first thing first, we always assess the site, making sure we don't have any, the patient doesn't have any infiltration or phlebitis. And right now, my patient looks fine. He's pretty good. He's fine. We always explain the procedure, possible side effects that Lasix could have, and the reason why the doctor is giving him Lasix. I would tell my patient to report any symptoms of pain or discomfort to me immediately. And again, perform my 9 rates, medication, 3 med label comparisons to the MAR, and again, we always make sure we have the right patient, medicine, dose, route, and time. Again, I'm going to just talk through it for time purposes. So to push the furosemide, I would have 2 3 ml syringes of normal saline so I can flush. I always remove air out of your syringes by pushing the plunger up. Always clean off your extension port with alcohol for 60 seconds. Going to insert my saline syringe, but we always aspirate to make sure we get blood return. Then we're going to, once we get blood return, we're going to flush it with the normal saline. And then that's when we're going to insert the furosemide. Yep, after we flush it, we insert the medicine. Oh, and then when we insert the medicine, we have to use our watch to time the rate of insertion of the medicine per recommended push rate. So yeah, we have to use our watch to time the rate of insertion of the med per recommended push rate. So once we push the med, we looked at our watch, we're going to flush again with, as always before and after, we always flush again with the normal saline. Always again priming them, make sure you don't have any air in them. So once we flush it, we're good to go, and we always monitor our patient for any adverse reactions to the medication. And being that this is the medicine, I will go ahead and record it, document it on my MAR. Then we have again, you wash your hands, remove your glove, wash your hands. And then now, if I was pushing it through an existing line, the differences between that, we always have to make sure our medication is compatible with the IV fluid and the bag itself. I mean, the IV fluid and the medication itself. Always clean the port off with alcohol for 60 seconds. And we would occlude the IV by pinching it off above above the we would occlude it, and pinch it off, inject the med, again using the time, using your watch for the time rate, if that was a existing line. So after we did our medication, we gave the furosemide. It's time to hook him back up at 100 cc's an hour. So again, we clean the INT port with alcohol for 60 seconds. We're going to use our 3 ml saline flush, again, priming it to remove the air. Once we prime it to remove the air, we can flush the INT, and we can go ahead and flush the INT. Always, trying to think. So we'll flush the INT. I had a brain fart. So we will clean off the INT port with alcohol. Flush it with my normal saline, of course, priming the saline. Flush it. So we flush it. Flush it. I think that's it. Yeah, we flush it, and then we'll remove our dead end off of our primary, and attach it and secure it with tape and turn the pump back on. And again, we'll program the pump and not program it, but we'll click that it's an existing patient, because he just went down to X-ray. Okay, so now the doctor has ordered the patient that he's fine. He can go home. He told me to discontinue the IV and let him know that he has a follow-up appointment in a week at his office. Okay, so again, I'm going in my patient room. I let him know, doctor discharged you home. It's time for me to go ahead and discontinue your IV. Again, you gather your supplies, you put on your gloves and your goggles. I better put on my goggles first, then my gloves. Okay, got my gloves, my goggles. Always turn my pump off. Turn my pump off. So again, it was running. I had the roller clamp on, and I'm going to turn it off. And then get back this time because it was hooked up because it was going at 100 the second time, and then I can take this off, disconnect that, and I can go ahead and trash all of that. Okay, so I'm just bringing my arm a little closer to me, and now I can go ahead and discontinue the IV. So at this time, I'm going to go ahead and remove my tape and kind of walk off the tegaderm, or loosen the tegaderm. So I remove my tape, loosen the tegaderm. I'm stabilizing the catheter. I have my gauze, and I'm going to go ahead and quickly remove the catheter and immediately apply pressure. So we apply pressure and make sure the bleeding is stopped. Again, we're going to hold it for 30 to 60 seconds, or again until the bleeding stopped. Okay, so the bleeding stopped. I'm going to put a new gauze on here, and I'm going to tape it down with my tape. Again, still holding pressure. I'm going to tape it down with tape. I'm going to apply my pressure dressing. All right, and I always assess my my site. Make sure there isn't any redness, edema, or any a hematoma. Okay, and again, I'm gonna discard my things appropriately. Being that this was in somebody, I will put this in my sharps. All right, and I clean up my mess. Everything that I don't need can go in the garbage. And I'm going to remove my gloves and goggles, and I'm going to wash my hands. And with dealing with IVs, we always have to document our nurse's note, report if our patient had any adverse reactions. Again, make sure our patient is comfortable, has all their personal possessions, call light is in reach. If he was in the bed, bed in lowest lock position. And I think that's it. Thank you.